Good afternoon, everyone. Welcome to Utah's Healthy Places Index 2.0 launch webinar. My name is Heather Borski. I serve as an Assistant Deputy Director at the Utah Department of Health and Human Services. And we are so excited to have you here today to learn more about recent updates that we've made to the Healthy Places Index. I think we have well over 400 people who have signed up for today's webinar, so that's so exciting. Our vision as the Department of Health and Human Services is to ensure all Utahns have fair and equitable opportunities to live safe and healthy lives. We achieve this through effective policy and a seamless system of services and programs. The Utah Healthy Places Index helps us meet this vision. The index was first launched in October 2022. And since then, staff from DHHS, local health departments, and partners from across the state have used the Healthy Places Index to support their work. And this tool is strongly supported by DHHS leadership. The Utah Healthy Places Index is a comprehensive tool for local health departments, local communities, city leaders, researchers, nonprofits, and others to explore community conditions related to the social determinants of health and help in measuring and mapping health equity. The Utah Healthy Places Index provides data and policy recommendations to compare the health and well-being of communities at the community level, quantify the factors that shape health, and turn data into actionable solutions. Again, we are so excited to launch Healthy Places Index 2.0 today, and I am pleased to turn the time over to Sarah Hodson from the Office of Health Promotion and Prevention.
Thank you, Heather. We really appreciate your support and the support of DHHS leadership on this project. I'm Sarah Hodson. I'm the Deputy Director of the Office of Health Promotion and Prevention here at DHHS. And we are so excited to have so many people here today to learn more about the updates to the Utah Healthy Places Index, which are live today. In 2021, the Office of Health Promotion and Prevention contracted with the Public Health Alliance of Southern California to create the Utah Healthy Places Index, which is modeled after the California Healthy Places Index. Our 1.0 version launched in October of 2022, and we're pleased to have the 2.0 version launching today. I want to start by acknowledging the teams that have been working on this project over the past couple of years. First, the DHHS HPI mapping team has been leading this work. This has been a coordinated effort where we have relied heavily on the various skills and strengths of our different team members. As you can imagine, this project has been a lot of work, so I'm really grateful for this internal team. Funding for the development of the tool came from the Violence and Injury Prevention Program and the Overdose Data to Action Cooperative Agreement funded by the Centers for Disease Control and Prevention. I also want to acknowledge the team from the Public Health Alliance of Southern California and Access Maps. And we're pleased to have Helen Dowling from the Alliance here with us today to present. We meet with Helen and her team regularly, and they are excellent partners throughout this process. We're going to start the webinar today with a poll question. Nathan's going to launch the poll. So please just take a minute to answer. What sector are you representing? So academia, a community-based organization, community member, education, healthcare, local government. We'll just give a few seconds to answer the poll. Great, okay. So it looks like we have a mix. We have quite a few from state and local government, but we also have some community-based partner organizations, academia, healthcare, and others. We're really glad to have so many of you here with us today. So I'm going to start by providing just a brief overview of the Utah Healthy Places Index. Then we will get to have a demonstration from Helen on the tool, which will highlight the 2.0 updates. We'll hear from a couple of our partners about how they're using the Utah HPI, and then we'll leave plenty of time for Q&A at the end of the meeting today. A few items of housekeeping. This meeting is being recorded. All participants are muted. You will receive a follow-up email with the webinar recording, and you are welcome to share that with colleagues, partners, or others who might be interested in learning about the Utah HPI. To submit a question for the Q&A, you will click the Q&A icon bar at the bottom on the toolbar. The chat feature has been disabled for this webinar. You can submit questions at any time, but they'll be answered at the Q&A portion at the end of the webinar. Okay, we're going to do one more quick poll. So this is on a scale of 1 to 10, rate how familiar you are with the Utah Healthy Places Index, with 1 being today's your first time learning about it, and 10 being you consider yourself a HPI expert. So we'll give just a few seconds to answer that poll. Okay. It looks like we have a really good mix of where people feel on this scale of 1 to 10. So that is great. If you're new to the HPI, we're really glad to have you here with us today. And I think even the experts will be pleased to see some of the updates that we have. So why did the Office of Health Promotion and Prevention decide to work with the Alliance to create the Utah HPI? In recent years, the Department of Health and Human Services has increasingly focused on the role of social determinants of health and how they impact health outcomes. We know that where we live impacts our health. The conditions in the communities where we grow, live, work, play, and age have an impact on our health and our well-being. In communities where there is available employment and an adequate tax base, high quality schools and education is supported. When there's affordable and safe housing, that means that residents are not exposed to overcrowding, allergens, or other hazards. Communities with healthy food options and available fresh produce support the nutrition needs of community members. When there's safe walking and biking and access to parks and trails, physical activity of community members can be supported. Communities with adequate public transportation help to ensure that residents can get to healthcare appointments, that they can access jobs, childcare, and other social services. And neighborhoods with strong social cohesion and community connections can improve well-being. These are the types of neighborhoods and communities that we want for ourselves, for our families, and for all Utahns. However, we know that the conditions in communities can vary drastically by neighborhood. It's the vision of DHHS that we ensure all Utahns have fair and equitable opportunities to live safe and healthy lives. But in order to do so, we must understand and address community conditions. It was with this understanding of the importance of community conditions and our vision for fair and equitable opportunities for all Utahns that led us to explore the idea of creating a mapping tool to help us do this. And when we were doing that work of exploring a tool, we were drawn to 4 specific strengths of the HPI. First is the granularity of the tool. Data are available at multiple levels, including Utah Small Area and Census Tract. This neighborhood level focus is important for identifying communities that can benefit most from resources. Second, the index is validated with an important outcome, life expectancy at birth. In fact, each of the indicators that make up the HPI score are positively associated with life expectancy at birth in Utah. Third, each indicator is supported by a wealth of policy opportunities, which provides communities with evidence-based policies to impact health. And finally, it is a positive framework. As the name implies, it's the Healthy Places Index, which speaks to community assets and refers extensively to the healthy community conditions, and also helps us to identify opportunities in neighborhoods that may be falling short. Once we decided to work with the Alliance to create the Utah HPI, we met with a variety of partners, both internal and external to DHHS, to create a Utah-specific tool that had indicators and policies geared towards Utah communities. Throughout 2022, we held partner engagement meetings with nearly 100 people from a variety of agencies and organizations. And we relied on these partners to provide input and expertise to help us identify indicators and policies that would work best in Utah. This extensive partnership engagement process was important for creating a tool for Utah that would be relevant across the state and would benefit the health of all. Since the initial launch in 2022, our team has worked extensively on providing training and presentations throughout the state. We continue to engage with partners in a variety of ways. And over the past 6 months or so, we've been working on the 2.0 updates that we are excited to be sharing with you today. As I mentioned earlier, one of the reasons why we were drawn to the Healthy Places Index is because it includes extensive policy guides that are tied to the HPI indicators, which makes it an actionable tool. Not only do we learn data about communities, but we have tools and opportunities to improve outcomes. This supports a public health approach of addressing policies, systems, and environmental changes to make healthy choices practical and available for all community members. Communities can explore over 300 evidence-based policy opportunities that are tied to the different policy action areas. Transportation is the example that you're seeing here. And then the communities can determine for themselves which of the opportunities works best for members of their community. Now we're going to get to hear from Helen from the Public Health Alliance of Southern California. She's going to provide a demonstration of the Utah HPI, highlighting the 2.0 updates that are live today. Helen?
Hi, folks. It's so great to be here today as part of the Utah HPI 2.0 launch. My name is Helen Dowling, and I'm the Director of Data Initiatives at the Public Health Alliance of Southern California. And my team, along with DHHS and Access Maps, who is our incredible map developer, we've been hard at work over the last several months doing everything from updating the data, upgrading our mapping application, and calculating a brand new HPI score. And before I get into the details of what is new, what is updated, I really can't say enough about how wonderful the partnership has been with DHHS and the level of involvement and engagement in ensuring that the Healthy Places Index really meets the needs of folks across the state. So again, I'm so excited to be here today and to share in this moment of our 2.0 launch. For those of you who are new to HPI or just need a quick refresher, I want to start with a quick primer on what you're looking at here on our map. So this is the HPI score version 2.0 that's currently loaded, and it's loaded at the neighborhood level, also known as the census tract. And our update means that we're actually looking at 2020 census tract boundaries. We actually updated all of our geographies to the latest available, and more on that in a minute. As Sarah also shared, HPI uses a positive and asset-based frame. That's our name, it includes our indicators, and it's also why our map uses this blue to green color scheme instead of reds or oranges, which can have a negative connotation. It was really important for us not to re-redline communities. So, to interpret the data that you're looking on the map, recognize that areas in light and dark green are places that have healthier community conditions according to the Healthy Places Index score. That is, they've got cleaner air, active transportation options, access to parks, better jobs, more educational opportunities, and really all of those other factors that contribute to better health. Conversely, places that are in light and dark blue have fewer health supportive community conditions. We like to say that those communities that are in dark blue, which comprise HPI quartile 1, the 0 to 25th percentile, dark blue communities, those are our priority communities. Importantly, while you're taking a look at the map right now at the census tract level, you can also view HPI at multiple geographies. So you can use this tool on our legend to switch between the geographies. So we include a number of standard geographies like zip codes and cities and towns, as well as several Utah-specific geographies like Utah small areas. We also have local health districts, and you can view data at the county level and school district level as well. So there are a lot of different geographies, and you can choose the one that best suits your needs. Although we always recommend starting off with the census tract because it really provides that granular neighborhood level look at the data. And particularly in more populous areas, you can find communities within just a few miles of each other, even within a 20-minute walk, that have drastically different community conditions. And if you're using a larger geography like cities, towns, or zip codes, you actually might miss those differences in community conditions. So we always recommend using that smallest geography, that census tract level geography, whenever possible. All right. In just a moment, I'm going to dive into exploring some community conditions with you on the map. But first, let me give you just a quick overview of what's new in HPI 2.0. So first, all new data, mostly covering the time period of 2017 to 2021, which was the latest available data. And as I shared earlier, all of our data are updated using the most recent geographic boundaries. So that includes 2020 census tracts, it includes the most recent legislative districts, and so on. And we've got our updated HPI score using all of our new data. So that's version 2.0. That includes new, updated, and improved data. And importantly, it maintains continuity with the Utah HPI 1.0. 20 of the indicators are the same. And we've added 2 new measures in this version, ozone and traffic volume indicators. And if you've recently taken a look at the Utah HPI 1.0 map, which is what this website was displaying just a few days ago, it might look a little bit different compared to 2.0, which is what you're seeing now. And it might look different, particularly at this scale, but I want to say that the majority of neighborhoods fall within the same HPI quartile as HPI 1.0, and a further third really only shifted up or down 1 quartile. So things might look different at this scale, but truly the HPI 2.0 update really maintains quite a bit of continuity with HPI 1.0. All right, so let's get into it and start exploring a neighborhood and some community conditions. So this is the fun part. You have lots of different options to find a community. You can type it into the search box here, or if you know where you're going, you can just zoom right into the map. And that's what we're going to do. So we're going to zoom into Salt Lake City. And if you want to explore the community conditions of any neighborhood, just click it. And with that, we're going to open up a community conditions panel. And the first thing you're going to see is the HPI score percentile rank. So we see here that this has an HPI score percentile rank of 24. We show you what this means on the legend, right? So this is a dark blue community. This is an HPI quartile 1 priority community. And we tell you how this compares to the county that it's within, as well as the city or town that it's within as well. So this tract's percentile rank is very similar to the county as a whole, but a little lower than the city or town average. And we also tell you how to interpret this score. This tract has healthier community conditions than 24% of other Utah tracts. Said another way, 76% of Utah tracts have healthier community conditions. So that's why this is a priority community. We also give you a little bit of information about this community, so the population, as well as what county and city and town that's within. So this is within West Jordan. And you can actually explore the individual indicators and the policy action areas that make up our HPI score version 2.0. If you're familiar with HPI 1.0, you might see a different arrangement of these policy action areas. That's because these policy action areas are ordered by how much they contribute to the overall HPI score. In HPI 2.0, indicators associated with the transportation and clean environment domains are weighted more highly than indicators within neighborhood, economic, social, healthcare access, etc. And all of the details for this are located in our technical report, which you can download off of the Utah HPI website. So let's actually dig in and take a look at some of the individual indicators that comprise a policy action area. So here in our transportation domain, we have automobile access, bike lane access, and traffic volume. It's always really important to kind of go from the HPI score, look at those policy action areas, and then the individual indicators, because the HPI score doesn't tell the whole story. Looking at those individual indicators, we can see here, for example, automobile access is almost in the top quartile. So this is a community strength. This is an asset here. But traffic volume is ranked very low. So this suggests to me, potentially an opportunity for improvement. And if you're curious about any of the individual indicators like traffic volume, and you want to know more about what this is actually measuring, where we got this data, and how it's connected to health, just click this little arrow and it'll take you to our indicator details panel, which will give you the specifics on this particular indicator, including what exactly it measures. So we can see here with traffic volume, it's measuring the average annual daily traffic along nearby major roads. And if you're curious about how this actually impacts health, we have this connection to health language here, which we find is really important to bridge the gap from folks who might be operating, within public health and understand these connections, to reaching across to other sectors who don't understand how those conditions might impact health. So we provide this information along with our linkage to our policy guides, and importantly, the technical definition for this. So you can get more details about what this indicator is, what it measures, where it came from, and the year of the data that it was published. And new, as part of our update, you can click on this little button next to more information about this indicator to actually directly download our technical report and data dictionary, which includes even more details about all of the indicators in the HPI. So if you have a question about the data, it's just one click away here. All right, I'm going to go back to looking at our policy action areas. So here we identified traffic volume might represent an opportunity for improvement. We can look here in our neighborhood. We see, for example, tree canopy represents, that's a community asset. Park access may be an opportunity for improvement. And this is interesting here. So we can see that employed is close to the top quartile. This is in quartile 3, but both above poverty and per capita income are low compared to other Utah neighborhoods, which suggests to me that perhaps employment might be high here, but wages might not be enough to make up for the cost of living here. So that suggests that maybe policies around living wages might be a good opportunity for improvement here. So it's really important to go beyond those policy action areas, look at those individual indicators. And even though this is a community that is indicated as a priority community, there are strengths here as well as opportunities for improvement. And it was important for us to really provide those assets alongside those opportunities. Beyond our individual HPI indicators, I also want to point out that we have detailed measures of race and ethnicity, which provides important context for the communities that you can examine on the HPI map here. Now, race and ethnicity isn't included in the HPI score, but we do make these data available very easily alongside that HPI information. And here we can see that about 49% of this community identify as white, and about 41% identify as Hispanic or Latino. You can also get detailed ancestry information here. So while we can see that 41% identify as Hispanic or Latino, about 92% say that they come from Mexico. Asian alone, we can see close to 5%, but there's a real diversity of ancestries here. Asian Indian, Chinese except Taiwanese, and Laotian as well. So this is really great information if you need to, for example, provide communications or messaging materials in different languages, if you need to know who the key messengers should be in your communities that you're doing outreach. As well as identifying like the key community-based organizations that you may want to work with to reach your populations that live in these communities. So really don't overlook this particular demographic data. And we also provide measures of equity, including historically redlined if these data are available in this community, a race and ethnicity diversity index, and a diversity of electeds measure as well. So I also want to share with you beyond the HPI score, because the HPI score was only part of our update process, and that just comprises 22 indicators. We updated all of our decision support layers as well. And so these are the measures that you can view alongside HPI. It really makes this tool a one-stop data shop. And at this point, we have almost 400 indicators beyond the HPI score to really give you a comprehensive view of what's going on in Utah from a number of different angles. Not only can you look at individual HPI indicators, so for example, if you wanted to just take a look at our park access measure, you can just look at park access by itself, or you can also look at any of our decision support layers, and we've organized them into categories here: priority equity indicators, community conditions, demographics and population, et cetera, et cetera. We've added 30 new indicators as part of this update, and we updated all the rest. There is an incredible wealth of data here for you to explore. Even if you don't end up using the HPI score for your project or program, you can take advantage of all of the other data layers that we've made available here, including many measures of different health outcomes available at multiple geographies. So for example, here you can take a look at any of these health outcomes. We've also added a number of new measures of health risk and protective factors here. So you can see these, many of these are available at the local health district geography as well. But many of our measures are all available at the census tract, and so you can view them at the multiple different levels of geography that we offer. So an important aspect of us having updated our data is that now there are multiple years of data that are visible through the tool. So for indicators that were available previously, like our asthma indicator, you can select the year of data to view older data, so the previous version of the data. And here you can, from the dropdown, you can pick the year of data that you would like to see. What's really exciting here is this opens up opportunities to use some of the other tools within our HPI map toolbox. And that's things like our compare data function, which will give you the opportunity to explore indicators side by side. Now you can look at two different indicators side by side, or you can look at the same indicator over time. You can do this, for example, with our HPI score. So I'm going to set our HPI score to version 1.0. And then we're going to take a look at HPI score version 2.0. And you can use this to navigate and kind of take a look at what's changed between these two versions in this map that's side by side. And because the maps are locked to each other, if you navigate one, the other one will navigate as well, which makes comparisons really, really easy. That's one example, but maybe let's take a look at an individual indicator and see how that might have changed over time as well. So we can look here at, let's take a look at voting. I'm going to select the older year of data on the left-hand side. On the right-hand side, I'm going to select the latest year of data, so you can see at the very top the indicators that you're comparing and the time periods. And now you can compare that individual voting indicator and see how that's changed. And sometimes with measures of community conditions, it can be difficult to see change when you're just comparing two short time periods together. But so just as something to consider when you're examining these community conditions indicators that have changed over time, but voting is definitely one where you can see clear differences even within 2 years. We can also take a look at, let's take a look at another measure of community conditions. So households with broadband internet. Right. So now we're comparing households with broadband internet from 2015, the 2015 to 2019 data, to our brand new 2017 to 2021 data. And by hovering over those communities, again, you can really see side by side how things have improved or changed over time. So having multiple years of data now really substantially unlocks a lot of new utility with the HPI tool. If you haven't used the compare data function before, I encourage you to check it out and really start to see how things have changed in your communities, how health outcomes have changed, and how many of the other measures that we include on our map have changed. So this is a lot of exciting things to explore on our brand new updated version of HPI 2.0. And I'm so excited for folks to explore the map tool, explore the brand new data, and learn how you can use the Healthy Places Index in your projects, your programs, evaluation, and so much more. Thank you again for having me, and I'm going to turn it back over to Sarah.
Thanks, Helen. Hopefully that piqued your interest in getting in and exploring the 2.0 version of the tool. Reminder that if you have questions, please put them in the Q&A box at the bottom, and we will get to those in the Q&A section. We have one final poll that I'm going to let Nathan take responsibility of here, and then turn the time to Nathan. Thanks.
Yeah, so this next question, we're just asking how you are or how you could use the HPI after this demonstration from Helen. Ways that you're excited. It looks like people are jumping in. Give it a little bit of time. So it looks like we have responses all across the board here. Community health needs assessment is towards the top, as well as identify and address health equity issues. But yeah, it looks like across all of the different options, we have a lot of people recognizing that they could use the HPI or are currently using the HPI to inform their work that they're doing. So I'm going to go through real quick and talk about our evaluation that we kind of did, and about some different opportunities for using the HPI that we've seen from partners and from people that we're working with. Next slide, please. So with the survey that we just did, or the poll that we just did, all of these are different ways that are currently being used. Community health assessment, strategic planning, grant application, designation requirements. We'll have our partners from Get Healthy Utah talk about their healthy communities in just a second. But also resource and funding allocation. Our fatality reviews are using the HPI to help inform their prevention recommendations. And then our universities are starting to use the HPI to kind of train future public health professionals in understanding community conditions and addressing social needs across the environment, across the state, which is really awesome. And there's a bunch of pictures here from partners and the work that they're doing. And we'd be happy to share that with anybody who would like any specifics. Next slide. So some quick metrics that nobody's going to remember, but we still want to just celebrate. We have almost 16,000 site views in the first 18 months of the HPI, nearly 7,000 unique visitors. We've done 70 plus trainings over the year and a half, training more than 2,400 individuals. And we've had the HPI mentioned in different news coverage and media coverage over 14 times that we know of, and potentially more. And we also have been awarded a couple of different awards. Last year, the National Association for Chronic Disease Directors recognized Utah Department of Health and our California partners with the Innovators Award for 2023. And then just earlier this month, the Utah Public Health Association awarded the mapping team the 2024 Public Health Hero Award, which we're really excited about. Changing directions slightly, we want to talk about opportunities that exist within the map, within the tool, to map your own data. This is something that hasn't been done as much as we would like to see. We know that lots of our partners have really great data sets that lend themselves really well to being mapped out. and adding them to the HPI can make using that data really much easier. So here's an example. We have emergency food pantries across the state, and this data set has both the names and the hours that these food pantries are open, as well as geographic information, so the addresses of where they're located. And so what you can do is you can enter this data set into some mapping software, and you can create points on a map that you can upload in a file to the HPI. And then, as you can see here, this is an example of these food pantries being mapped out as points on a map. And then you can look at our decision support layer for food insecurity. And you can see those areas across the state that have more needs around food, or that have higher rates of food insecurity. And so let's look, for example, the second purple geography down is Carbon County. It's a rectangle, and there's only one point on there for the food pantry. And so what you could do is you could say, hey, Carbon County looks like there's a need around food security there, and there's only one food pantry open. So you can go back to your data set and see that the food pantry there in Carbon County is only open on a couple of days and during very specific hours. And so maybe there's an opportunity to either change the hours or to open up another food pantry. The food insecurity data is only available at the county level. So maybe you could look at an HPI score and look at it at the tract level and see if there's different areas that have economic needs across the county, and make sure that food pantry that exists is close to those individuals that are lower income or that have more economic support needs, to kind of inform the work as you're trying to increase food security across the state. And so, yeah, that's one quick example. The Utah AGRC, what does that stand for? I should have written this down. But yes, we have a geographic information systems, a GIS state team, and they have all sorts of data available that's been mapped out for you, and you can pull up these maps. So for example, hospitals across the state is some data that you can download from the AGRC website, and you can use those hospitals to kind of inform, if you wanted to look for example, about how to address suicide, and you wanted to see if there's specific communities that don't have access to acute mental health care facilities, where would those be? And you could use that data set on top of the HPI and kind of inform the work going in that direction. So there's lots of really cool options for using your own data in the HPI, and we'd love to work with you to make that happen. If you have data that you would like to put into the HPI that you don't know how to do, feel free to reach out to our team, and we'd love to help support you. Next slide. And so I'm going to also turn the time over to a couple of our partners. We have Tanisha Holiday from Bear River Health Department, who's going to talk a little bit about how they've used the HPI at their health department. And then after her, Morgan Haddon from Get Healthy Utah is going to talk about their Healthy Communities designations. Go ahead, Tanisha.
Thank you, Nathan. So I'm an epidemiologist that works for Bear River Health Department, and Bear River Health Department used the Healthy Place Index when we were constructing our community health improvement plan after our community health assessment. After our priorities had been chosen by our subcommittees, we had selected our objectives, and we wanted to ensure that we were using evidence-based strategies to achieve our objectives. So one source we turned to was the HPI policy guides. Here we wanted to ensure that our strategies would be effective. One thing we really liked about the policy guides was that we were able to sort by topic that were applicable to each of our objectives and our specific committees, and that each policy then had an evidence rating, whether it was from emerging to strong evidence, that we are then able to dig deeper into using the references and the resources that were also provided in the HPI policy guides. We use, the HPI the HPI policy guides in specific to find out what other organizations were doing and how they implemented those. So one area in specific we used was we have an educational subcommittee looking at educational attainment. And one of the policy guides recommended to collect data, analyze and use disaggregated data for education. So what we did is one of our objectives was to conduct a qualitative research project with students, teachers, and parents to identify root causes of absenteeism. So that's how we've used the policy guides and the HPI.
Thank you. And Morgan?
To apologize if there's any background noise. I stepped away during a conference and tried to find the most quiet corner that I could. But I am Morgan Haddon. I'm the program coordinator at a nonprofit organization called Get Healthy Utah. And one of the things that we are most known for doing is the Healthy Utah Community Designation. This is a designation that cities and towns across the state of Utah can apply for to receive recognition for the efforts that they are making to improve the health conditions of their community. There's several requirements to earn the designation. The first is they have to submit a letter of commitment from their mayor. The second is they have to have a health coalition that meets together regularly. The third is that they need to tell us what health strategies they're implementing in their area. And then the fourth is where the Healthy Places Index comes in. And that's where we ask them to come up with a 3-year health plan for their city or town. The designation must be renewed every 3 years, and the purpose of that is to help communities continually be thinking about health rather than just thinking about it once to earn a designation and then forgetting about it. So as a community is putting together their 3-year health plan, within the application, we have linked several data sources where they can look at the data around the health conditions of their local community. And we invite them to look at that data so that they can then identify the priority areas where they need to focus on for the next 3 years, right? Do they have the greatest need for improved food access? Do they have the greatest need for improved physical activity infrastructure? And then base their plan and the strategies they want to implement off of that data. So we were really excited about the creation of the Healthy Places Index because that just fit perfectly with the data needs that these communities had. So again, just cities and towns around the state, we invite them to look at this data source to get that overall snapshot of the various health conditions in their community so they can then hone in on what they want to prioritize for their 3-year health plan. We recently had the opportunity, or actually are in the middle of it, where we are going around the state and doing 11 different road shows where we are educating communities across the state about this designation program, about different resources like the Utah Foundation's about building healthy communities. And we're also incorporating in our presentations the Healthy Places Index, where we're trying to increase awareness of this resource and really just trying to get city and town staff using this in their day-to-day work. So that's what Get Healthy Utah is doing. And we've been really pleased with how useful this tool has been for the partners that we're working with.
Thank you. So yeah, a lot of really cool examples of how the tool has been used in the last 18 months, and we're really excited to see what you all will do. Feel free to reach out to us if you have unique use cases that you'd like to share, because we'd like to share your use cases with everyone else so that we can continue to grow and learn from each other. Thank you, and I'll turn it back to Sarah.
Thanks, Nathan. And thanks to Tanisha and Morgan for sharing that information about how they use the Utah HPI to support their work. As you saw in the poll question we did a few minutes ago, there's lots of different ways that people are using the HPI, and we have lots of partners we could have highlighted today who are doing some really great and innovative things with the Utah HPI. But thanks especially to Morgan and Tanisha for joining our webinar. Now we'll move to the Q&A portion of the webinar. We have plenty of time for questions. As a reminder, submit questions in the Q&A button at the bottom of your screen. All participants are muted and the chat's been disabled, so you'll need to use the Q&A if you have a question. Natalie is going to moderate the Q&A portion for us, so I will turn it to Natalie.
Thank you, Sarah. I actually want to start with the questions already responded to by Adrian and others in the chat, just to make sure that everyone received the information. So the first question, I'm going to direct this toward Helen. So the question came in, I'm curious about the excluded census tracts. Is the population too small to show meaningful results?
Yeah, that's a really good question. So census tracts were not included for one of two reasons. Either their population was less than 1,500 or their group quarters population. So that means like an institutionalized population. Those could be correctional facilities, nursing homes, university dormitories, etc. If the population in those kinds of congregate settings was above 50%, those tracts weren't included. So the vast majority, I think it's 99.2% of Utah population is actually covered by the Healthy Places Index. And there is a small handful or dozen or so of census tracts that are excluded from the HPI score. However, we may still have data for those tracts through our view indicators function. So if you don't see data for an HPI score, you can still look at our decision support layers, and there's lots of other data that's likely to be available for those places.
Thank you, Helen. The next question is also for you. So is there a way to aggregate tract geographies to arrive at a combined HPI for the aggregated geography?
Yeah, excellent question. And that's one of our favorite tools that we think doesn't get used enough. So by all means, you can create aggregated pools of multiple neighborhoods pulled together, for example, to generate an HPI score for your project or service area, for example. And to do that, you can access our pool geographies function in the tools menu of our interactive map application. And it's as simple as just clicking the neighborhoods or zip codes or cities or towns that you want to pool together and calculate an overall HPI score.
Thanks, Helen. Next question is also for you. So what are the major data sources for the HPI?
Yes, excellent. So most of the data that comprises the indicators in HPI score version 2.0 come from the American Community Survey. And there are a couple of other data sources that we use, like the US EPA and the Department of Housing and Urban Development, as well as some Utah specific data sources like the Geospatial Resource Center, but most are coming from the American Community Survey.
Also, another question for you, Helen. Have you considered the implications of color blindness for folks working with this resource? I believe that blue and green are indistinguishable.
Yeah, so that's a really good question, and I so appreciate it being asked. There are different forms of color blindness. And for the most common types, the Healthy Places Index map is just fine. But in those circumstances in which you might need a different color scheme, most of our indicators can actually have the colors, you can customize the color scheme to what works best for you and for your accessibility needs. And that is through a function called Edit Display, and that's within our tools menu on the interactive map.
Another question for you, Helen. Can we download the interactive versions of the maps from specific census tracts?
So the interactive version, so like that community conditions panel with all the breakdown of that information, you aren't able to download that specifically, but you can download the source data for it. It's available on request from DHHS, or you can access it through our interactive API interface that's on the website. So if you go to api.utah.healthyplacesindex.org, you can sign up for an account and you can download data for your community, your zip code, your city or town, or any geography of interest.
Next question also for you, Helen. I'm an epidemiologist at the Colorado Department of Public Health, and I'm considering building something similar for Colorado. Can you share the methodology you use to calculate the index scores?
I'm very popular this afternoon. I'm flattered. All the questions coming my way. So, okay. There's a short and there's a long answer for this. The shortest of the answers is I'm going to direct you to our technical report, which you can download from the Utah Healthy Places Index website, and that will give you all of the details for how we calculated it. But in short, the short version of the long version is we used a methodology called weighted quantile sums regression in order to simultaneously maximize the association with life expectancy at birth and overall HPI score to generate the weights that have been applied in each of those domains. So as I said earlier, when we were looking at those policy action areas, that certain policy action areas count more when we're calculating an overall HPI score. It was that weighted quantile sums regression method that we use that empirically determines those weights to maximize the association with life expectancy at birth. Again, please see our technical report for all of the nitty-gritty details.
Thanks, Helen. Okay, your popularity streak might have come to an end. We have another person who can answer another question. So this one goes to Amanda Smith. Where does the youth data come from? Is any of it from the SHARP survey?
Thanks. Adrian did answer this in the chat too, but yes, the youth data or adolescent data in here is from the SHARP survey. And those were newly added for the 2.0. They're primarily sourced from the SHARP survey data, but I did want to emphasize that they're only available at the local health department level, nothing lower than that, just due to data sharing constraints that we have around the SHARP data. Thanks.
Amanda, another question, Helen. We're coming back to you. Are there any data sets, sources, or elements that include pharmacies and or point of care test and treat, for example, home pregnancy tests or at-home colorectal cancer screenings?
So not within our base set of decision support layers. I'm not sure, and I may have to kick it back over to Amanda, if any of the indicators that you provided as part of our new update includes any measures like that, or if there's a plan to collect those.
I don't believe so. Nathan, I think you might be more familiar with this too. I'm not sure if we have any point of care test data that we could include. Nathan, do you have anything to add?
No, nothing comes to mind. It's definitely not any of the 30 indicators that we added currently, but we can look into that and see if there's data sets like that available. But yeah, that would be a great case. If anybody has those data sets, we could upload those as new shape files in a chloropleth, the color version of the map. Instead of points, maybe you would do a color version of the map that you could upload. But yeah.
And then Sarah, I saw you come off mute. Did you have anything to add to that before we jump to the next question?
And Nathan covered it. I was just going to say that's a great example of creating your own account and uploading data to view on your own account.
And Sarah, this next question actually comes to you. If a unit at DHHS would like to contribute data to the HPI, who should we talk to?
That's great. Yeah, you can talk to anyone on our team. You can reach out directly to me. We'll put in the chat our generic OHPP email, and you can reach out to that, and we're happy to talk about data or other uses of the HPI within DHHS.
Great. And then Helen, another question for you. Is there a formatted report output which can be exported to correspond with the map output?
Okay. The answer, confusingly, is yes and not yet. So the yes part of that is you can download a map screenshot very easily. So there's a little button and the interactive map at the top right of your screen that says download map, and that's going to take a screenshot of whatever it is that you're looking at. It's not exactly a formatted report, but it is something that you can then, take and insert into your own copy of the data that you may have downloaded or copied from the interactive map tool. The not yet part of that response is to say that that's coming. So just because we are launching this Utah HPI 2.0 update today doesn't mean that we're stopping work on the Healthy Places Index platform. And in fact, we're actually gearing up for another big platform update that will be rolling out in California in a year and in Utah shortly afterwards. And that will include a brand new report export function. So not available today, but coming soon-ish.
Thanks, Helen. Sarah, I have another question for you. Are there opportunities for training and consultation on how to use the Utah HPI?
Yes, there are lots of opportunities for training and consultation. You can reach out through that OHPP email that I put in the chat and let us know. We are happy to come and give a general presentation about the Utah HPI or do more in-depth trainings. We've done a number of trainings that focus on a particular case study and then walked with teams through how they might use the HPI to support that particular case study. I'll also just give a quick plug. We are starting what we're calling a Utah HPI Champions program. And this is for users of the Utah HPI to do some additional training and learn some kind of in-depth use of the tools and features so that they can present and work with groups on training and consultation. So if you're interested in that, you can also reach out through the email, but there are lots of opportunities to be trained. You can also on the DHHS website, which we've linked in the chat, there are some very short tutorial videos. So the features that Helen showed, as well as additional features, there are 3 or 4 minute videos on how to use each of those. So that's a great place to start and learn and explore just on your own some of those tutorial videos.
Thank you, Sarah. And that was actually our final question, so I'll turn it back to you.
Great, thank you. Thanks, Natalie, for that. So we have just a couple of next steps. We are asking that each of you take some time and explore the Utah HPI. You can access it through the DHHS website. On the website, as I mentioned, there are a number of tools and resources, including the tutorial videos. There's tip sheets and a very extensive frequently asked questions section. There's links to the technical report that Helen mentioned. So it's just a great place to spend some time exploring. If you've been a user of the Utah HPI, we would encourage you to go on again and use the 2.0 version and see the changes, see some additional information that's available to you there. You can always reach out to us for more information about training, consultation, any other questions you might have. Please reach out through this OHPP at utah.gov email. And then I just want to finally thank Heather, Helen, Nathan, Tanisha, and Morgan for their presentations today. And thank each of you for joining us. We look forward to hearing more about how you're using the Utah HPI to support your work and how that is being done to improve community conditions throughout Utah. So thanks for joining us today.